One of the first things I want to make sure that you walk away with is something that you're already doing, but we're going to improve the quality of it. So, of course, all of you are already breathing. You're breathing, taking breaths about 6 to 10 breaths per minute. But I want you to now notice it, something you probably weren't noticing right before this moment. And as you notice it, notice how the air enters your body. For some of you, you might be nose breathers. It's going in through your nose, so notice that. Some of you, you might be breathing with your mouth. Just notice that. Now notice where the air goes. Where the air goes. Does it go into your chest? Or does it actually go into your tummy area, the diaphragm? Take a moment to notice that. If the air is going more into your chest and only your chest, then you're breathing too shortly. I encourage you to get comfortable wherever you are and just notice how you can allow the air to go all the way into your tummy. And as it's going into your tummy, if you notice that it's kind of uncomfortable or you're constrained, check your seating position or standing position for those of you who are doing this at a standing desk. Just try to get comfortable so that the air fully goes into your diaphragm. I don't want you laboring in your breathing. I don't want you uncomfortable. But I want you to just notice how when you notice your breath, when you actually consciously become aware of it, you can notice how it can become fuller and more complete. During the course of the day, we are frequently, constantly being challenged, and different things are coming into our minds or in our physical presence, and we have a tendency to stop breathing. I'm often telling people when I'm seeing them, when I'm sitting with them, just notice your breathing. I've noticed that you've been stopping and starting over. So right now, just notice the breathing. Notice when you're taking a nice, good inhalation, it goes deep within you, deep into the diaphragm. And then there's a point at which it stops for just a split second as it turns around and as you exhale. Try to keep it fluid, almost circular. You're paying attention to your breathing. It gives your body, your mind, your emotions a rest because right now you're turning your perceptual focus on just the flow of air, cool as it enters your body, and warmer as it exits your body. Now, I encourage people to do this, not just for a minute, but if you've got a minute, great. But I often encourage people to do it anywhere between 5 minutes, 5.5 minutes to be exact, and upwards. If you've got 6 minutes, it's great practice. Because what can happen after about 5.5 minutes is that the body starts to respond to the increased quality of your breathing. It starts to respond to the oxygen. Remember, oxygen is one of those things that if you're in the hospital and you need oxygen, they have to write a prescription for it. It's a controlled substance within a hospital. Why is it so important that you need a doctor? It's because we need oxygen. And oxygen's what keeps us alive. It's the one thing that if we don't get it continuously for about 15 to 20 minutes, we can perish. We're often not getting enough of it during the day. Continue to breathe in and out as you listen to